The views, comments, and opinions of the following program do not necessarily reflect those of Morris Media Studios, MorrisMediaLive.com, or its affiliates. Listener discretion is advised.
Good day, beloved. Welcome to Faith Without Borders. I'm your host, Pastor Kelvin Sauls. It is a joy for me to have you with us this day as we come together here at Faith Without Borders to see how we can provide a progressive and prophetic platform where we seek to educate and agitate, organize and mobilize for racial equity and racial justice through thought-provoking and solutions-driven dialogue to realize God's beloved global community. Yes, it is about how we bring our perspectives together and to see how we can find synergy between what's happening locally here in Los Angeles, nationally in the United States, and also globally, around the world. And so it is just a joy for us to have you with us here at Faith Without Borders. Today, our theme is From Vaccine to Vaccination, Opportunities and Obstacles in Fighting COVID-19 in Black and Brown Communities. And of course, looking at our context here in the United States. And I just have the joy this morning of welcoming, our guest today, from the Charles Drew University of Medicine and Science. It is none other than Dr. David M. Carlisle. He is the CEO of Charles Drew University of Medicine and Science in the Watts Willowbrook area of Los Angeles County. He's been providing stellar leadership there since 2011. Dr. Carlisle is a board-certified internal medicine specialist and an extraordinary scientist. Additionally, he is a published author in health policy, quality of care, medical education diversity, and committed to eliminating health disparities. It is a joy for me to welcome to Faith Without Borders Dr. David M. Carlisle. Good morning, sir. Good morning, and welcome. Okay, we're working on getting him on. Good morning, Dr. Carlisle.
Yes, I am here.
So good to see you. Blessed morning to you. Yes. How are you? How's the family?
We are all doing well in the COVID-19 environment.
Yes. I know you've been extremely busy as both a physician, as a scientist in the midst of everything that's been going on, and just really appreciate our relationship and partnership here in Los Angeles to see how we can facilitate health and wellness, here in Los Angeles, in the county. And I want to just quickly check in with you, given the rise, of COVID-19 and the challenges it has brought, it has really, challenged a lot of organizations. And so can you just quickly tell us, how has Charles Drew University adjusted, to this challenge in terms of how to fulfill its mission?
Well, thank you, Pastor Sauls, and again, great to be with you. The first thing that we did was really internal, like many other universities and colleges and schools. We shut down our campus and moved all our teaching offline. about 90% of our courses. The only exceptions are those clinical students, nursing students, medical students, physician assistant students, X-ray tech students, who are about to join the health professions and engage in the front line of the fight against COVID-19. Those students are still doing in-person instruction, but 90% of our work is online. We also, during the summer, we're honored to be asked by Supervisor Ridley Thomas to open a COVID-19 testing site on campus. And in doing so, we discovered a few things to make it more accessible to the community. At that time, Los Angeles was doing mostly drive-through testing, and the testing sites were fairly peripheral. There was nothing operated by LA County in the south part of Los Angeles. The only other site was at the Crenshaw Christian Center.
Yes.
And so we opened our site. We started out doing about 400 people a day, 200 to 400. And then we realized we could do much better. The first thing we realized is obviously when you're in an under-resourced community, not everyone has a car. So drive-through testing is not really that effective. So we started doing walk-up testing, and our numbers doubled. And they doubled again when we basically said a number of people don't have access to the internet. So the whole idea of using the internet to make an appointment just doesn't work. So we started doing walk-up testing. And our numbers went up again when we started going out into the community and saying, hey, we have free COVID-19 testing available to you. You can come in today and get it. And our numbers went up again. Then finally, our numbers really started breaking 1,000 people a day. When people realized that the testers, CDU students and others, looked like members of the community, were members of the community, spoke the languages of the members of the community, gathered with the members of the community, often went to church with members of the community. And that was the final message. And so we became one of the busiest centers in all of Los Angeles. Now that center has moved across the street to the MLK campus, the hospital campus, Med Center campus, run by the MLK Outpatient Center and my good friend CEO Yolanda Vera.
Yes.
They're still doing 1,000 people a day using a lot of the techniques that we developed for COVID-19 testing. So that's kind of where we are. Our campus remains closed. We anticipate being closed in the spring semester as well, continuing with in-person instruction for our clinical students. That said, our university has also been very involved in dialogue and discussion about COVID-19, as you can imagine, with physicians, with nurses, with public health people. We certainly have a perspective on COVID-19 that we're very happy to share with everyone.
Yeah, and that's really what I just appreciate about CDU, and I am proud to be affiliated and associated with Charles Drew University, because really it's cutting edge, 1, 2, it's seeking to be real and relevant, 3, it is a community-centered approach to how do we facilitate access to healthcare in under-resourced communities. Just to put it all into perspective, I think it's important that we let folk know what is the mission of the Charles Drew University of Medicine and Science, because that will help folk, understand, I think, how your leadership has been so mission focused, that it's just been extraordinary around that. Would you just tell us the mission of CDU?
Yes, I will start out with our vision, because the mission is how we accomplish our vision. Our vision is excellent health and wellness for all in a world without health disparities. And the mission addresses how we get there. Our mission is to train young people from under-resourced communities to go into the health professions and serve those under-resourced communities with excellence and compassion through a combination of outstanding engagement and social justice, health equity, diversity, excellence in clinical care, social services, and research. That is the mission of Charles R. Drew University of Medicine and Science. And we are, as you said, Pastor Sauls, we are and always have considered ourselves to be a community-founded institution. We only exist to serve members of the community, South Los Angeles, and communities like it.
Yes. You're speaking my love language just by articulating that mission and vision. You're speaking my love language in terms of how I seek to live out and practice my faith and provide leadership in that way. And we're just grateful when I was at Home United Methodist Church for the partnership that we had, with the Charles Drew University as a community, hub, for that ongoing education. So really appreciate that. Let me, just continue and ask you, this next question. Given the rise in both infections and death due to, the coronavirus, how would you describe, Dr. Carlisle, the current moment in the U.S. that we find ourselves in?
Well, this is really a very important question. This is the heart of the matter. Our country, the United States of America, is actually impacted by COVID-19 worse than virtually any other country in the world. We've heard about Sweden. We've heard about Britain. We've heard about Italy. We've certainly heard about China. Those countries actually have fewer deaths per capita, per person, than the United States does. We really dropped the ball, unfortunately, fairly big time in not preparing for COVID-19 when we saw it coming, and we certainly did see it coming. As a result, thousands and thousands and thousands of Americans have died that probably could be alive today if we'd had a more effective policy. I think of the country of Canada, and Canada is very much like the United States in multiple ways. You can be standing right next to a Canadian and not know they're Canadian, even when you're hearing them speak. Basketball, music, just like the United States. Canada has half the death rate of COVID-19. They've done the same things that we've done in terms of masking, social distancing, home isolation, everything that we've done. The difference is that their central government issued very effective policy directives to the entire population of Canada, and the population got on board and pursued and followed those directives. That's what we failed to do in the United States. As a result, we have well over 200,000 people dead in this country. Currently, we're in what's called the third wave, the third phase, the third surge. We don't know when it's going to stop. If you look at the numbers in LA County right here, where we are, every day we're setting a new record in terms of deaths. Every day we're running out of ICU beds. Every day ambulances are lining up outside of emergency rooms. This is a world pandemic. It is a clear and present danger to everyone. And yes, lives are at stake.
Yeah, absolutely. And just that consistent message facilitated with intentionality and integrity, is just so important. As you know, as we speak right now, we now have a vaccine approved, and it's probably being delivered in so many, spaces and places as we speak, right now. And so the question, really, that a lot of folk are asking, that a lot of us are talking about, is really, the safety and efficacy, of the vaccine. Would you share some thoughts around that?
Well, yes, as you mentioned, Pastor Sauls, I'm a physician. I also have I'm also a researcher. I have a PhD. I believe in the scientific method. Much of where we are today in our whole entire society throughout the world is due to scientific advances based upon the application of the scientific method. And I've watched the vaccine development, and I can assure everyone that while the vaccine was developed, the vaccines have been developed in less than a year. They've gone through every phase of vaccine testing: phase 0, phase 1, phase 2, and phase 3. The only reason that the FDA has now approved a COVID-19 vaccine is because that vaccine has gone through all of those phases safely. And more than that, has demonstrated significant effectiveness against COVID-19. Think about it this way. A vaccine is kind of like a seatbelt. You're driving down the freeway. You're going 65 or maybe 70 where it's legal. You're following all the rules, putting on your blinkers when you change lanes, keeping a safe distance. You're doing everything right. But you can still have a car accident. And that car accident can be a fatal car accident. And maybe the only thing that will keep you alive is putting on your seatbelt. The vaccine is like that seatbelt. And just imagine maybe the conditions are a little bit worse. Maybe it's raining or someplace else it's snowing. You're thankful to have that seatbelt there because it gives you more than a little bit of extra protection. It can be a game changer if you ever have a significant accident. I urge everyone, when you're offered the possibility, the opportunity to take the COVID-19 vaccine, to go ahead and take it. Yes, it's brand new. Yes, the development occurred in a year. A tremendous scientific accomplishment. Yes, it's got side effects when you take it. You may feel sick for a day, but that vaccine, for many people, will be the difference between life and death.
Absolutely, and thank you for that illustration. I just think that was just a powerful illustration, just around how one can look at the vaccine as a seatbelt, and also just the confirmation that there was integrity in the process of development, and as Black people, and we're going to get to the historical pieces around this, but as one who have observed this and watched it. What role, has Black scientists play in the development of the vaccine, and will continue to play in development of other vaccines. So we know that there's been involvement, on the Pfizer end, as well as in the U.S. through NIH and other organizations. Do you want to just share a little bit of that? I mean, we were in the room. I mean, we folk that look like us. We were at the table, making sure that, or doing what scientists do in terms of the development, of these vaccines, right?
Well, our current scientific community, while it still has opportunity for growth, is well aware of the lessons of history, and those lessons of history clearly demonstrate a lack of reaching out, a lack of engagement, and a lack of participation with the African American community and other communities of color. Therefore, when we started to engage in the vaccine development process, we made sure that participation by African Americans and other peoples of color was a central component of the vaccine development program. This was an important criterion for the vaccine development. When you look at the various companies, Pfizer, Moderna, et cetera, you look at their participation rates by African Americans and people of color in their clinical trials, you see rates that are the highest ever for clinical trials, 30-some%. One company started out and received significant criticism about its lack of participation by peoples of color in their trial. They suspended their trial, went back and recruited more people to bring their numbers up. There may have been a time in history when that would not have been done. But today, we know it's important because the issue is you can't expect us to use it if we haven't been at the table to develop it. And because African Americans and other communities of color are disproportionately hit by COVID-19, it's important for us to be part of these clinical trials. And so that's the big lesson. As you mentioned also, Pastor, when you look at some of the scientists that have been involved in the actual details of vaccine development, some of them, many of them, are individuals of color. I recall the female scientist from the NIH working with Dr. Fauci, who's African American. So in today's world, we do have people who are engaged at this level. We do have African American and other scientists of color, and they've been very much engaged in the vaccine development process. So, I can't say that everything is perfect, but this is the excuse me, this is the best effort that we've ever engaged in with communities of color to be part of clinical trials that I'm aware of on a large scale like this.
Mm-hmm. Yeah, certainly. And of course, with Pfizer, there's been, a person of Nigerian descent that's been a part of that development. So we've been at the table, and you are so right. The whole piece around equity and making sure that we are at the table is just so essential around that. And yes, we know about what happened at Tuskegee. We've known about the whole history in gynecology and how that happened with black women, and as well as what happened with immigrants in Georgia in terms of some experiments that were performed on them. But you are saying that we have to be aware of that particular history, and I thought Dr. Fauci responded to this very, very powerfully this past week. When CDU was part of several organizations, that presented two, webinars around this, and just getting real about this conversation, that we have to acknowledge, what was, done wrong, and unjust in history, and see how that can be a lesson for us in terms of how do we continue to upgrade and improve, who we have at the table, so that we can make sure that what is being developed, that black folk are at the table, in terms of that, right?
Absolutely, this is this is really important. And you referenced Tuskegee. You referenced, I think the physician last name I think was Sims, mm-hmm. whose statue was in Central Park. But yeah. A lot of his fame as a surgeon was derived from doing unethical surgeries on African American women. Fortunately, that statue has been removed from Central Park in New York. Mm-hmm. We could talk about Henrietta Lacks, whose DNA and cell cultures continue to empower medical research today. But she received no credit when she was alive. Mm-hmm. And her family still not really received the credit that they deserve for the scientific advances that have come from her mother's cells. It goes on and on and on and on. But today, we know that these are issues, and certainly I and my institution, we are all committed to making sure that these issues, whenever they arise, are addressed directly. And this has been a central component of the vaccine development process. We benefited from learning about the horrible lessons of the past.
Absolutely. Now, recently, as I just referenced, CDU joined several HBCUs and historical civil rights organizations such as the Urban League, the National Medical Association, etc., in writing a powerful love letter to Black America. I watched that and was just deeply moved by that. I want to play, a video about that, Dr. Carlisle, and then get your response to it on the other side, just yes. about this. So let's watch that video of the love letter to Black America.
Dear Black America, we love you. We affirm that Black lives matter. And as Black health professionals, we have a higher calling to stand for racial justice and to fight for health equity. In the spirit of unconditional love for every single Black American, we have locked arms in an initiative to place the health and safety of our community at the heart of the national conversation about COVID-19. Respect for our Black bodies and our Black lives must be a core value for those who are working to find the vaccine for this virus that has already taken so many of our loved ones. Our colleagues across healthcare know that we are urging our community to take safe and effective vaccines once available. However, for this to be successful, they must do more to earn your trust now and in the future. We are on the front lines in care delivery and in key decision-making roles, from the lab to the clinic to the virtual boardroom. we urge you to hold us accountable. Please wear your masks, continue social distancing, hand washing, and avoiding indoor events until vaccines are widely available. With the holidays around the corner, we want nothing more than to break bread with our loved ones. But tradition cannot stand in the way of our health. We also ask you to join us in participating in clinical trials and taking a vaccine once it's proven safe and effective. We know that our collective role in helping to create a vaccine that works for Black people and that we trust has an impact on our very survival. Please visit blackcoalitionagainstcovid.org/loveletter to learn more about the work we are doing to keep our beloved community safe. We will keep you in our hearts while we work to create a world that is healthier and more just than the one we know today. Love, America's Black doctors and nurses.
That's just profoundly powerful. Dr. Carlisle, why did you and so many of our HBCUs, the Urban League, and others, why did you decide to find it necessary to write this letter?
Well, yes, it was necessary. It was an honor and a privilege to write this letter. I do want to give a shout out to my friend and former CDU president, Dr. Reed Tuckson, for kind of jump-starting a lot of the work that we've been doing together. And I want to recognize, of course, the three other presidents of the historically Black medical schools in the United States, Meharry, Morehouse, and Howard University, as well as the Urban League, as you mentioned, and other organizations for being there at the table for the African-American community. We recognize that trust in the healthcare system is an issue. We recognize that trust in a system that has often abused people, even abandoned people, is an issue. We recognize that these issues are as relevant today as they have been historically. So therefore, our community is of course, very inclined, and we certainly understand, to have concerns about the COVID-19 vaccines. So our message, based on love to our African-American community, is that we've got your back, we've got our back, and we are watching out for you to make sure that the vaccine process addresses our concerns and addresses our needs and addresses our endangerment by COVID-19. So this is a powerful message. It's just like you would engage in, a member of your family, a loved one, when they're having some uncertainty in their lives, and we're sitting down and saying, we've got our back, and we are there for you, and we'll make sure that you can have every confidence in what we are proposing in the way of COVID-19 vaccines.
Yes. Thank you. Again, I just love that letter, and I've posted it, and I'm going to continue to do that to make sure we get it out, because I think that's how we get to a more healthier and a more just, beloved community, as we move forward. I want to get back to the vaccine. I believe we have to take 2 shots. Can you maybe tell us a little bit about why we should take 2 shots?
Well, I'll say a couple of things. First of all, we did develop these vaccines in record time. The biomedical technology that was brought to bear was just spectacular. This is cutting edge science that frankly didn't exist as little as 5 years ago. And we're able to do it only because scientists in China released the genetic code for the novel coronavirus literally 2 weeks after the virus first appeared. They didn't have to do that, but they released that code to the entire world. And as a result, scientists and researchers in the United States immediately were able to start working on a vaccine. So that's the process. The vaccines that are first developed are probably not the vaccines that will be around necessarily maybe 3 years from now, 5 years from now, assuming that we still have an issue with COVID-19. At that time, I hope we don't, but we could. Mm-hmm. But these are the vaccines that are the easiest to develop safely. Mm-hmm. And as with other vaccines, there are other vaccines that we take today that require 2 shots, that require boosters. When you take a flu shot and you're over 65, like I am, you get an extra strong flu shot. So this is not unusual in the vaccine process at all. But the vaccines that have been developed today do require the second shot. Basically, the first shot kind of sends a signal to your body. It's turning on your immune response, focused on the coronavirus itself. The second shot takes that focus and amplifies it to make that response even more powerful. And that's why that second shot is very, very important. A first shot is not important, it's important, but it's not adequate to achieve the right kind of immune response. That second shot is essential. Again, it amplifies the effect of the first shot.
Mm-hmm. That's very, very helpful, to know as we, move into this. I want to get to this whole movement, very active movement around anti-vaccination. And this is a movement, of course, that's here in the United States as well as around the world. I mean, I got a video yesterday from home, from South Africa, about that vaccination movement, especially in the faith community. And that's why I wanted to do this, show from a faith perspective and bring together, faith and science, because I believe these are two sides, of the same coin for us, as we move forward towards both personal and community vitality. And but there is this movement that's out there. Can you, just give us a sense, around how we respond, to this, because you and I know people, can have the right to their opinion, but you can't have the right to your own facts, as we look at these health challenges related to the development of vaccines, but it is a real concern, for us. Your thoughts on how we can effectively respond, to this with right information, that can hopefully facilitate, more healthier, and well communities.
Well, this is why at an individual level, you really want to go to your own healthcare provider ultimately and kind of ask them the question, is this vaccine good for me? Should I take it? And because you trust your provider, and your provider is not like somebody else that is talking on the internet. They're somebody they're somebody you've known for years. They may have taken care of your parents. They're trusted. And this is the whole point about trust. As you point out, Pastor Sauls, anybody can go on the internet and make a video, make an announcement. And many people have. And many of those announcements are disreputable. They're unfortunate. But I always say, think about who is providing the message. Is this your trusted provider? Does this person represent your trusted provider? Are they trusted providers? Are they organizations that are active in your community? And when you apply that filter to these messages, then clearly the evidence says, take the COVID-19 vaccine, because we, your trusted health professionals, have got your back, and we're saying take it. The whole anti-vax movement got started probably about 20 years ago, 15 years ago, via an unfortunate and since discredited article that appeared in one of the leading medical journals in the world, Lancet. That physician was basically, they lost their ability to practice. They're no longer a physician. And the results of the article, when examined by reviewers that did not happen the first time around, were clearly false, clearly misleading, clearly fallacious. But it really started the anti-vaccine movement, which is based upon skepticism about healthcare. Now, that skepticism is healthy to a certain extent. I tell patients whenever somebody recommends something to you in the world of medicine, surgery, a procedure, a test, ask them, is this safe? What is my benefit? Is it going to help me? Ask somebody else. Get a second opinion if you want to. And those two opinions will hopefully correlate, and you'll be satisfied that you're in good hands. So medical skepticism is important. You don't want to do too much and do the wrong thing. But this is why, for example, I'm here with you today.
Yeah.
This is why the love letter was written. This is why so many people, including those at Charles R. University, are taking to the airwaves, taking to the internet, taking to the streets in our community to basically provide the message. Well, you can listen to those individuals. Many of them are doctors on the internet, speaking against vaccines, speaking against the COVID-19 vaccine. But who do you trust? Who do you believe? And I would say, put your belief in the doctors that represent your community and the other healthcare providers who represent your community. As you said, anyone can have an opinion. And in today's world, it's much easier to express that opinion. It's easy to express it in a well-produced, articulate, glib, colorful, even compassionate way. But what is the message, and who is the message coming from? I've never seen a public health person espousing an anti-vaccine perspective. That's just not seen. So think about who is providing the message. And in this case, the message is coming from, the president of Charles R. University, your community-founded institution, the president of Morehouse Medical School, the president of Meharry Medical College, and the president of Howard University, as well as many other HBCUs around the country, as well as your African-American nurses and doctors associations. The list goes on and on. Compare us to the people who are presenting the anti-vaccine messages. And in my mind, when you compare the two perspectives straight up, there's no comparison here.
Yeah. Absolutely. Thanks for that. That's so important. And, I'm working on a show with some, multiracial, multireligious leaders to get to this challenge, of the anti-vaccination movement, just to talk about it, theologically, and otherwise, to see how we can, continue to find synergy between faith and science as we move forward. My final question to you, and I really appreciate you being so generous with your time. Final question is, of course, in the U.S. now we're looking at having about 100 million, individuals vaccinated sometime in the spring, and a lot of elation and excitement around of the vaccine. What is your guidance to us in terms of our behavior so that we can stay on, the battlefield fighting the good fight against COVID-19?
Well, yes, and it is always a pleasure to be with you, Pastor Sauls, and your audience. Thank you very much for this splendid invitation this morning. It's my honor to be with you. Well, one thing I would say is remember, on the front lines of COVID-19, you have healthcare workers. Even in the absence of adequate personal protective equipment, those individuals, doctors, nurses, custodians, were out there in hospitals and emergency rooms helping patients, risking their lives to do so. Many of them lost their lives as a result. But this tells you something about the commitment of our healthcare professionals. Will they turn their back on a patient? No. They're there for you when you need them. And that is a definite commitment by all of our healthcare professionals. And they have, many of them have, again, paid the ultimate price for that commitment. But that's what it means to be a healthcare professional, being there for your patients. Going forward, we're dealing with a new situation, a new disease entity, COVID-19. We're learning. We certainly don't know everything about it. We hope that as we achieve this vaccine-induced immunity by large members of our community, that the disease will start to go away. Mm-hmm. But that doesn't mean that we can abandon safe practices yet. It doesn't mean that we can abandon face masks. Mm-hmm. It doesn't mean that we can abandon social distancing. It doesn't mean that we necessarily need to go, that necessarily we can go back to everything that we were doing before. Ideally, we want to go there. That is everyone's goal, because we have suffered. Businesses have closed. People have lost their jobs. People are going to bread lines, food lines. So the amount of suffering out there is huge in our society. And we want to get back to the day when all of that is behind us. Mm-hmm. But to do that, not just to get 100 million people vaccinated, we need to get 200 million people vaccinated. We probably need to, in the United States, need to get probably ultimately 300 million people vaccinated or more to really turn the corner on COVID-19. And we're going to get there. Right now, the first doses of the COVID-19 vaccine are being shipped, but our production capacity is not what it's going to be ultimately. Mm-hmm. Those first doses are going to go to these healthcare workers that are risking their lives to save patients and care for patients with COVID-19. They will next go to other very needy populations, including the population that we, of course, are talking about here today, people of color who are disproportionately victimized by COVID-19. Mm-hmm. People of color, communities of color, the African-American community, the Latino community, Asian Pacific Islander communities are high priority communities for the COVID-19 vaccine. Yeah. So this is an effort that's just starting, and there are going to be bumps in the road here. There are going to be issues. We've not done this before in American history. We're producing things that we haven't produced before. We're using manufacturing techniques that are just coming online. So everything is not going to proceed smoothly. But I think everyone just needs to know that the intent is there to make everything the best it can be for everyone.
Absolutely. And again, I mean, this is a season amid the crisis, the death, the disparity, and the despondency. This is a season of innovation. However, as we embark on it, it's also a season, for evaluation and then elevation as we continue to make sure that racial justice and racial equity, are lived into as we looked at that. Dr. Carlisle, our profound thanks to you and your colleagues, everybody on the front lines, for the sacrifice and for being out there. And again, thank you for your leadership at Charles Drew University of Medicine and Science. And please, greet the family, especially Mom and the entire CDU community. And looking forward to our ongoing collaboration forward to facilitate vitality in fighting health disparities.
On behalf of everyone at Charles R. Drew University of Medicine and Science, our students, our faculty, our staff, our alumni, and our trustees, thank you very much for asking me to be here this morning. And yes, I will pass the word along to my mother, and she'll be thrilled to hear that.
Great. Thank you. Blessings. That was Dr. David Carlisle. He's the Chief Executive Officer at the Charles Drew University of Medicine and Science. What an awesome conversation. And looking forward to our ongoing work with him here in Los Angeles as we connect with folk, elsewhere. So grateful for just the insights that he provided for us. We'll be right back.